welcome. Happy New Year. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We're hosting press briefings in Itasca County every other Thursday to address COVID-19 related issues and questions. And today we will discuss mental well-being throughout COVID-19. Our speakers include Tanis Henderson, school counselor, Independent School District 317, Jesse Colter, mental health therapist, and Cree Larson, Executive Director, First Call for Help of Itasca County and 211. And then we will follow our panelists with a question and answer portion, and we'll be joined by John Pedersen, Senior Director of Support Services, Grand Itasca Clinic and Hospital. We'll begin today with a situational update. Thank you to all of our Itasca County residents for doing their part in preventing the spread of COVID-19. Our numbers have steadily decreased in December. We've identified 53 new cases in the past 7 days, 117 in the past 14 days, for a cumulative total of 2,751. Sadly, we have had 43 deaths in our Itasca County residents from COVID-19. Our sincere sympathies to the families of those who have passed from this virus, to those who are hospitalized, in an ICU, or who have not returned to their previous state of health after having a COVID-19 infection. On behalf of public health, we offer our sympathies. For anyone who would like to know if they have COVID, were potentially exposed to COVID over the holidays or otherwise, or just wanting to know if they have COVID at all, they can be symptomatic or asymptomatic. Testing is occurring today and tomorrow from 12 p.m. to 6 p.m. at the Grand Rapids High School. I will put the link to register in the chat for our media, although walk-ins are very much welcome. They have plenty of test kits and availability to accommodate anyone wanting to take a test. It is considered no barriers testing. It is free. It's regardless of whether you've been exposed or not, regardless if you have any other risk status. And again, if you did any type of gathering over the holidays or otherwise, we would love for you to go get a test to make sure you're not spreading it to others. Again, January 7th and 8th, 12 p.m. to 6 p.m., Grand Rapids High School. For some updates related to our local schools, the Itasca districts are moving towards more in-person learning throughout this month. With this, they are able to test their staff every 2 weeks. All of our districts are working on implementing this program. I'm very happy to say that after weeks of planning within Itasca, we do have vaccines within our county. They are rolling out in phases and tiers. The initial phase includes hospital workers, emergency medical service workers, including ambulance, fire departments, and law enforcement who respond to 911 calls and provide medical care. Our residents and staff who work in skilled nursing facilities and assisted livings will follow, and some are actually already being vaccinated this week. Our other outpatient healthcare workers are included in the first phase, and they will follow the long-term care staff and residents. As guidance on phases of vaccine rollout evolve, we adjust our plans. We're in contact with our healthcare providers on the phases they are responsible for, and will continue to collaborate as we administer the vaccines to our Itasca County residents in the coming weeks and months. Each entity that receives vaccines are responsible for a certain sector of the community to vaccinate. Hospitals are administering vaccines to their staff and the ambulance staff. Pharmacies involved in the Federal Pharmacy Partnership Program, often referred to as PPP, are responsible for the skilled nursing facilities in our county and some of the assisted living residents and staff. Public health has been responsible for our EMS workers that are law enforcement and fire, and our community vaccinators. We will move on to our assisted livings that we are responsible for next week, and the outpatient healthcare workers will follow. We are so appreciative of how patient our Itasca County community members are as we move through this vaccine rollout. We are so excited, and we're as excited as you are to administer the vaccines and move forward to this new area of COVID-19. Please know the first phases are administered based on your employment, such as being a healthcare worker, where you reside, such as an assisted living or a nursing home. As we move through the sectors and phases, you will be notified by your employer if you are next in line to receive the vaccine. For persons with chronic healthcare conditions or in the older age demographic, you will be notified by your healthcare provider when it is your turn to receive the vaccine. This is a great time, if you don't already have a primary healthcare provider, to establish with one. For those who have the available technology, enroll in the electronic healthcare systems such as My Health for Essentia, My Chart for Grand Itasca. The more ways your healthcare provider can contact you, the better. And of course, we will continue to provide this information twice weekly in a written format, and we'll provide information every 2 weeks in these press briefings on where we're at with vaccination. Our healthcare partners will also be updating via their communication channels. We again ask for your patience as we move through the vaccine rollout. We are guided at this time by the CDC and the Minnesota Department of Health. Our healthcare partners are guided by their regional and state entities. At this time, we cannot stray from our priority groups. As vaccines do become more available, we will keep the public informed on the groups we are currently vaccinating. One note on the vaccine, it is a 2-part series. You do need to receive both of the doses of the same vaccine to be considered fully vaccinated. The second doses are coming. They're based on the amount we received for the first doses, so no need to worry about whether it'll be available. They will, if you've had your first vaccine, you will have your second vaccine coming. Minnesota Department of Health has begun updating their website on the amount of vaccines that are administered per county. Itasca collectively is just under 800 doses given already. And again, this is on the Minnesota Department of Health website. For everyone who is patiently waiting for a vaccine, thank you so much for sticking with what we know prevents the spread of COVID-19. Keep wearing your mask, keep social distancing, avoiding large gatherings. We can see the finish line. It's at a very exciting place to be right now, but it will take many more weeks and months to get there and get the vaccine rolled out. Frequently asked question, do we need to wear masks after vaccination? The answer is yes. Until we have a large amount of the population vaccinated, we will need to wear masks to continue to prevent the spread of the virus. Executive orders, I wanted to touch on that. We have done a really nice job in northern Minnesota of bringing our COVID numbers down during the most recent dial back by our governor. Now, as of this coming Monday, January 11th, we are able to dial forward. Bars and restaurants will reopen at 50% capacity for indoor dining. Our schools are having in-person learning. Our sporting events have begun practicing. They're so important to our youth and our community. Games can begin on January 14th. Spectators will be allowed, but up to a certain capacity. We know this is so important to our children, to their families, to our communities, and we're very pleased to have the ability to move this forward. Frequently, I will actually now move to our speaker, and our next speaker is Tanis Henderson, school counselor, Independent School District 317.
Thank you, Kelly. Today we're going to talk a bit about self-care, and I think self-care has become kind of a catchphrase, but there is truth to that we do need to take care of ourselves, because it's easy to fall into traps of distress when we don't nourish our inner beings. There are many ways that we can take care of ourselves, and there's not a single recipe. It's the small acts of care that ripple into larger acts over time and that make the most difference. Self-care also doesn't require you to reinvent your life. Just do more of what's already working for you. You don't need a large chunk of time. It could be a few breaths, a few minutes outside, or something more in depth, depending on the time that you have. It's not always either about adding something to your life. It can also be about taking something away, allowing the space to say no, prioritizing what's important to you, and setting boundaries. With many people working from home, lines between home and school and work have become kind of blurred. And so it can be hard to say no, when someone's calling and wanting your help. But even though we do want to help each other, we have to take care of ourselves first. And sometimes that means setting that boundary so that we can take care of our own responsibilities. Modeling self-care is so important for our children. Self-care practices and awareness can start at a young age. And our little ones have undergone a huge transition over this past year. And so helping them understand stress, relieve stress, and take care of themselves has never been so important as they are right now. Any act of self-care is an act of love, and I just encourage everyone to continue to try to find those ways and spaces to increase that in your daily life. Thank you.
Thanks, Tanis. And I will now introduce Jesse Colter, mental health therapist.
Thank you, Kelly. As Kelly said, I'm a therapist. I work throughout the lifespan, primarily children and their caregivers, so I see all ages. And I think one of the things that I'm noticing, regardless of age and where you live and what you do, is that everybody is struggling, everybody. And I think, I agree a lot with what Tanis had talked about, that self-care piece is so important. And I think we all know the things that we need to do. We need to eat healthy, we need to exercise, we need to sleep, we need to nourish mind, body, and soul. But how many of us, I think probably most of us, aren't really great at actually doing that, following through. So I think right now more than ever, we just really need to be intentional in whatever that self-care is that you are going to follow through on. So if you say you're going to do it, for some people it might be, I'm going to take a shower 3 days a week. If they're really struggling, it might be, I'm going to get out of bed every day by 9 o'clock. For others, it's exercise. For others, it's nutrition. But just being intentional and doing those things that you have set your mind and know will help you feel better. I think right now, we're in a place that none of us has ever been. And as human beings, we crave structure, stability, routine, and predictability. And we just don't have that right now, because literally nobody in the entire world knows when and how this will end. And so we're all kind of in that heightened state. And I think some of the things you might notice in yourself are you're forgetting things. You're really struggling with things that used to be really easy, or things that you used to be able to do in this amount of time are now taking you twice as long. So I think just giving yourself a break, giving yourself some grace, because we're all there, and that's a direct result of what we're going through right now. I think doing some of these self-care acts, directly affects our stress levels, which in turn affects our overall mental health. One of the pieces that maybe gets missed because we're so focused on, the exercise, nutrition, a huge piece right now is that connections, is maintaining connections with others. It might be family and friends. It might be your next door neighbor. It might be your furry friend. It's whoever that is, maintaining those connections, because they're just as important for you as they are for the other people in your lives. I think it's kind of like that whole oxygen mask thing. You have to take care of yourself before you can possibly take care of anybody else. And so finding what works for you is key, and following through, being intentional.
Thank you, Jesse. And we will now hear from Cree Larson, Executive Director, First Call for Help, and 211.
Hi, Kelly. Thanks for having me come on and be a part of this. When I thought about what I would possibly present today that could be more helpful, and joining on and bringing more ideas into the self-care, I stopped and thought, what if one of our struggles is that we're not taking the time to identify we really need it, especially if we have a daily routine, a weekly routine of doing self-care. Those levels of self-care right now might not meet where we are due to, COVID, change in finances, government strife, some of the quarantines, the breaks in our family routines, having our kids home. It might be that even if you are doing self-care, you may think, well, I'm already doing it, I don't need to do anything else, when truthfully, we all might need more of that, being more intentional and more aware. We may be doing self-care and still have this ambiguous feeling of discomfort, like I'm doing my self-care, I'm doing everything that I think I should, but I still have this discomfort. And what is that? Taking a minute to identify that. Could this be fear? Because sometimes fear creates that discomfort. Oftentimes that fear is caused by scarcity of something. Typically, when someone's afraid of hunger, of going hungry, not having enough food, there's that underlying ongoing sense of fear. I think right now, currently in our situation, that fear could be caused by the scarcity of our emotional supports, and the sense of loss of safety because of what we're all experiencing right now through our elections and COVID and work changes and closings and school schedules. And so my one hope would be that we could take a minute to identify that ambiguous discomfort. What's that about? Oftentimes these situations remind me of the frog in the kettle scenario where the frog's in the kennel, it goes in at room temperature with a small fire underneath it, and we consistently just adapt to the change of environment, change in stress, change in temperature, not taking a minute to realize that this is really a distressing time. We're just re-engaging ourselves, readjusting to the tolerance. And I think that self-care really can be just slowing down for a minute and identifying, why am I feeling uncomfortable? Not letting it be okay with, it's the same discomfort I felt yesterday when I was doing all my self-care and the day before that I was doing my self-care, because fear and that discomfort can really be emotionally debilitating. And so if I could empower everyone to do a couple things, is just to slow down for a minute and identify the presence of that stress and discomfort, rather than ignoring it, knowing you're currently doing some self-care and just plowing through with what you need to achieve in the day, whether at home or with your family at work. And then once you've identified, it's there. My level of discomfort is there. Knowing yourself enough to know what to do about that. It might be, like Tana said, more of something or less of something. Connecting more, connecting with someone you haven't. And we talked before about the isolation and the social distancing doesn't mean cutting off all interaction. It means changing its form. So you're still connecting, because the scarcity of emotional connection is hard on our systems and bad for us emotionally. And so to focus on yourself during this, because it's going to help you help others with better intention and working collectively through activities and giving to others as we all try to get through this pandemic and through all the other things that are happening connected to it. If you have been doing self-care and you're thinking it's working and you just are not able to come up with for yourself in your home what other self-care things you can do, First Call has developed a website in conjunction and support with Itasca County Health and Human Services called StableEmbrace.com. This is a taking and giving community where you can go onto the site, take activities that maybe you're willing to try for yourself, but also leave an activity behind that works for you that isn't on the site. So it's a growing community of individuals who understand that they need self-care, and maybe in a different way, different shape or form than they're using now, and using that site as that give and take for health. And so thank you so much for giving me a couple minutes to just talk about understanding and slowing down, understanding you need self-care and what that looks like.
Thank you. And we will now move to the question and answer portion of the press briefing. We ask the media to state your name and the organization that you work with in the chat feature, and then we will ask our panelists to respond. And just as a reminder, John Pedersen, Senior Director of Support Services, Grand Itasca Clinic and Hospital, is here. The first question was from Kathy Lynn, KOZY. We are asked all the time how many people are hospitalized and in the ICU. I will gather these numbers and respond to the media via email on that after this press briefing. I did put the testing link in for our site at the Grand Rapids High School for the media to share. Again, you can walk in, but the testing event, Grand Rapids High School, 12 p.m. to 6 p.m. today and tomorrow. Kathy from KOZY, is Stable Embrace still being updated? And Cree did answer that. Yes, it is being updated. Thank you for that explanation of the site, Cree. Other questions? I did want to ask our presenters today, if someone is having some concerns, what would be some warning signs? And I'm not sure who would want to take that, but you all may have a different perspective. Jesse, do you want to start with that? What would be some causes for concern?
Mm-hmm. So I think one of, some of them are big and obvious. If, we're drinking more than we probably should, we're eating more than we should, or not enough. I think those are the obvious ones, but other ones can even be coping skills that we've in the past looked on as something helpful. So some people like to go out and be with more people. That could develop and morph into inappropriate contact with others. If it could be you're an introvert and you like to be alone, if you find yourself withdrawing and pulling away, spending more time in bed than you normally would have this time last year, say. I think those are subtle signs that, okay, so even though these things that maybe have served me in the past, exercise is another great example. People who maybe exercise in moderation now, over the top, like every single day, twice a day, so that all these things that used to be a normal in moderation, anything that's going outside of what that normal was for you before can be a huge key. Your body too is going to tell you oftentimes, stomach upset, physical, somatic symptoms, but also that piece that I mentioned about you maybe noticing that piece of just you're struggling to do work might seem so much harder. Things are taking you so much longer than they used to, or just forgetting things. I think that's all a piece of this. And just, again, that piece of just acknowledging where you're at, what's going on, and how it's different than it used to be, and reaching out for help.
Thanks. Tanis or Cree, would you like to add to that?
I think, as we talked about before, just taking the time to breathe and a moment to yourself to feel what's going on with your body, because our bodies are going to be telling us that discomfort that's been there for a very long time, taking the time to recognize it, or a new discomfort that we're feeling, not brushing it under the carpet, but taking a moment to ourselves to understand there's something different going on, and what could I do for myself to remedy that, to relieve some of that pressure or discomfort.
Thanks.
I think it's also important for parents to kind of keep an eye out for any major changes with their children, anything out of the norm. And always, reaching out to school counselors at the school. You don't have to have a diagnosis to connect with us, and we're more than willing to talk with your student or with you about any concerns that you have. Some things are normal teen things or normal childhood things in their development, but some things aren't. And, we have access to services and knowledge of resources, and, can also help connect you with, mental health counselors or first call for help if that's something that you need also.
Thanks. Any other questions? All right, seeing none, thank you again to our panelists, and thank you to all of you in our community for helping keep our numbers down in December. Keep it up. Happy New Year.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.